Hi everybody, Dr. Cory here. We're going to talk about spinal stenosis and what chiropractic care can do to help alleviate those symptoms. First and foremost, we need to define what spinal stenosis is. So what is actually occurring is the narrowing of the central canal of the spine, which houses the spinal cord itself. Most commonly, it's in the cervical and lumbar spine, and it's very common in most individuals over the age of 50 because it is sometimes attributed to during the aging process and the wear and tear we have on our bodies. That being said, some symptoms that will occur in the cervical spine when people have stenosis is numbness and tingling in the hands, cervical pain, weakness in some of the muscles of the upper extremities, and then loss of sensation, whether it be in the hand or different parts of the arm. Going down to the lumbar spine, we have weakness and numbness in the legs, balance issues. A lot of common symptoms are cramping when standing, walking for long periods of time. That's usually alleviated by bending forward or backwards. But both of these types of stenosis can definitely be treated by chiropractic care. Now, we can't open up the canal. There is some degeneration that occurs with that. But our goal is to promote as much mobility and alleviate any pressure on any parts of the nerves or spine itself. So when we're talking about mobility, we're trying to move the spine in the proper directions, making sure there is no fixations in those areas, cause muscle tightness and more pressure on those nerves. So when I say the word fixation, I mean as a chiropractor, when I'm feeling or palpating the spine, I'm looking for a sensation that's similar to a block of cheese. I say that as when you press on a block of cheese, it has a gummy feel to it and it springs back to you as you let go. If I feel your spine or palpate and it feels more like a block of wood, that's a much tougher surface and it's not giving like the spine should. And that's telling me that the joints of our spine aren't moving segmentally and they are just becoming stuck. We're also looking at the discs, making sure they're not bulging or herniating in any directions, because that'll also cause some narrowing of that canal, which has already become smaller itself. So if you are suffering from any types of those symptoms, definitely come on in. We can evaluate you, take a look, and see what we can do to help.